So yes, I'm going to talk a little bit about the clinics and our really exciting product that we have coming up really soon. And it's called evolving to a hospital-based outpatient department. So that said, on June 11th, CMS, or Centers of Medicare and Medicaid, is going to designate some of our North Oaks provider clinics as hospital-based outpatient departments. So essentially, our clinics will be departments of the hospital, which, for those who don't know, as it currently stands, they're freestanding clinics, no different than a private practice office, if you will. So which clinics, you ask? Some of the clinics that are actually on campus. So all of our providers, our physicians, nurse practitioners, physician assistants that are actually on this campus, so either in the building right across the parking lot or in our admin building, are all going to be in this hospital-based department designation. So why convert clinics to hospital-based outpatient departments? This model of care fosters an integrated and collaborative environment where hospitals and providers work more closely and together. So essentially, we are able to gain some economies of scale from a quality standpoint. We're able to ensure patient safety and a number of other factors like that. It's supported by Medicare and has been adopted by hospitals all across the country. I think the last stat I saw was somewhere north of 60% of all hospitals in the United States use this model. It's also very prevalent throughout the state of Louisiana. If you look around to our neighbors to the right or to the left of us, many of those hospitals are in this model as well. Hospital-based outpatient departments are held to be a nationally recognized service and patient care standards, and this basically means that we're also going to be subject to Joint Commission, which I'll talk about in a second. So what you need to know about this transition: our hospital-based outpatient departments must meet all applicable Medicare rules. They must participate in Joint Commission accreditation process to demonstrate that they meet the standards for patient care, safety, et cetera, to make sure we're providing effective care. And then the clinics located off campus don't qualify. So the cardiology practice across the street, our independence practice, our practice in Satsuma, et cetera, none of those qualify because the requirement from CMS is that you have to be 250 yards from the hospital. So what's not going to change? Well, the way I've kind of chose to say it is North Oaks is still going to be North Oaks. Our commitment to provide excellent patient care is not going to waver. The way you make appointments and get in to see our providers is not going to change. The way you receive services from our physicians, our nurse practitioners, our PAs, it's not going to change. It's going to be the same. Same level of quality is going to be provided to our patients. And then what may change? Our billing process and some of the co-payments. Specifically, we must follow what Medicare rules actually state for our billing for care for providers for hospital-based outpatient departments of the hospital. So those patients that are covered by Medicare, Medicaid, and all our VA plans, and any supplemental Medicare payments, they're now going to receive two bills, or what Medicare designates as a split bill. One is for the provider services, so what your physician, your nurse practitioner, your PA, and then another is a facility fee. So for your labs, your x-rays, et cetera, they'll come in two components. Last but not least, your co-payments for outpatient services also may change depending on your insurance and any other secondary payer that you may have. So this specifically deals with our Medicare population. Is probably going to be the most impacted by the change. And this really is contingent upon what your policy actually looks like, and that will dictate what your terms actually will look like. So that said, we're encouraging all of our community members and constituents that are actually going to be potentially impacted or experience this to please reach out and call this number here, 985-230-2580. We have a group of people who are actually ready to be able to answer and field any questions. They're going to work with you on an individual basis to talk about what your out-of-pocket expense will be, if anything at all, and we're certainly looking forward to being able to help you. So that being said, that's all. So thank you.